So today's topic is geriatric nutrition. It's chapter 39, page 510. Those who have the textbook, page 510, chapter 39. So if anyone is joining late, please help them out with the page numbers or chapter name. So aging gracefully is an art. Okay. Aging is not a disease condition. Aging is a biological process. Okay. And aging gracefully without any disease conditions, being healthy psychologically, physically, mentally. Okay. That is called aging gracefully. Okay. So it requires a lot of nutritional support, uh, healthcare motivation. Okay. So with these aspects only one can age gracefully. So, because in the past 50 years, we have seen a rapid decline in infectious diseases. Okay, people are living longer. Okay, and it is predicted that by 2050, 30% of the people in all the industrialized country will be over 65. So, we are looking towards an aging population. Okay, in all the developed countries and industrial countries. So there is going to be a rise in chronic diseases because elderly people, they suffer from a lot of chronic diseases. The risk of malnutrition is also high, okay, in the coming years because of increasing elderly population and requirements of senior citizen healthcare facilities, hospitals for the aging population. Their investment has to be done. And if malnutrition is going to be a situation, there could be dependence on other people because of physical weakness, muscle wasting, okay, increased risk of falls and fractures. Because of all these factors, senior citizens of of tomorrow will be dependent on somebody else for their daily needs. Okay, it is seen that nearly half of the population, elderly population, who have undergone hip fractures are malnourished. Okay. So, geriatric nutrition, when we talk about this topic of geriatric nutrition, it applies to all the principles, nutritional principles that we can use to delay the effects of aging and disease, and also to help in managing physical, psychosocial, physiological, psychological changes that are commonly associated with aging. Okay, how much ever we can delay these all areas, that is what is the target of geriatric nutrition. And elderly, or what we call as senior citizens, are usually people above the age of 65. Okay, so even with in the geriatric population, we have classification: young, old, and the oldest old. Okay, young old means people who are between 65 to 75 years of age. Old means between 75 to 85 years of age, and oldest old means people who are above 85 years of age. So the focus of geriatric nutrition should be a well-balanced diet, okay, with which also delays in heart diseases, cancer, stroke, okay, because these are the leading causes of death among the elderly population. Restricting calorie intake, consuming more antioxidants, these things can, these nutritious habits can increase your longevity. Then physiological changes during aging. Okay. Physically, internally, what changes happen to a human body when they are aging? First is sarcopenia. Sarcopenia is a condition in which fat in the body, it replaces muscle because muscle wasting happens. Okay, muscle wasting is accelerated with aging. So the body composition changes. Wherever initially you had muscles, that area is replaced by fat. Okay, that condition is called sarcopenia, and it happens to everyone. It is a part of sarcopenia, is a part of aging process. And people who exercise, particularly they do a lot of weight training. Okay, when you do a lot of weight training, you are reducing, it slows down the process of sarcopenia. And because of this decrease in lean body mass, basal metabolic rate, okay, uh, sarcopenia happens. Even the basal metabolic rate, it declines about 5% every decade, okay, in your adulthood. And because of this decline in your basal metabolic rate, there is a drop in your calorie requirement. You have to cut down a lot of calories. Okay. Protein reserves should also be is also lowered. So you have to focus on protein rich food as well. Dehydration has to be avoided. Some gastrointestinal changes during the phase of geriatric, digestion and absorption will reduce. Okay. The digestive hormones and enzymes production will decrease. Because of this, there is a lot more time required to digest and absorb and also empty the intestine. Okay, these all processes will slow down. And there are high chances of elderly citizens developing pernicious anemia because your mucosa, gut mucosa, stomach mucosa is not producing enough hydrochloric acid. Okay, so that could lead to pernicious anemia, constipation, lack of absorption of vitamin B12 because of pernicious anemia. Okay, it is very common in the developed countries, elderly citizens suffering from pernicious anemia. Constipation is also very common because gastric emptying slows down with age. So people use laxative. Older people, they use laxative. If they are not taking enough amount of water, if they are physically inactive, they may have to use laxative to meet their uh, gastric emptying requirements. So these are the changes that happens to GI system. Then your musculoskeletal system, what changes happens there? There is a drop in your bone density, bone mass because of demineralization. It usually starts in 30s and 40s. Okay, you don't have to get old to develop bone demineralization. It starts by the age of 30s and 40s, and in women, this demineralization process is accelerated with menopause. So because of this, the skeletal system, your bones, bone structure, it becomes more vulnerable to fractures and osteoporosis. And there is also inadequate intake of calcium, vitamin D. Okay. Because calcium and vitamin D, it helps to retain your bone mass. It prevents enough amount of calcium and vitamin D in your diet will prevent bone demineralization. Okay. And if there is not enough intake of vitamin D and calcium, that will lead to bone demineralization. Then sensory and oral changes. So your taste buds decreases, okay, in elderly people. The number of taste buds they have, it decreases. So the perception of what is salty, sweet, okay, these things will decrease. So it will automatically affect their appetite, okay. They will not find things as tasty as before. Then there are a risk of conditions called xerostomia. Xerostomia is a situation in which your salivary glands are not producing enough saliva. Okay, so it will lead to dryness in the mouth. And more than 70% of the elderly people are affected by xerostomia. Their salivary glands is not producing enough saliva. And also people who have dentures, elderly citizens who have dentures, they don't chew food as efficiently as those with who have natural teeth. Okay, so these things will affect their things will affect their oral health. Dryness of the mouth will lead to other risk of infections as well. Then organ changes may occur. Insulin secretion is decreased in pancreas, and because of which risk of diabetes will increase. Not able to digest carbohydrate enough properly. Renal function will also decrease. Your GFR rate will decrease after the age of 40s in some people who have a family history of some kidney conditions, kidney disorders. Cardiovascular changes. Blood pressure increases in women after the age of 80. In men, blood pressure increase will take place during the mid-adulthood, midlife. But in older men above the age of 80, blood pressure usually decreases. Cholesterol level increases in men at the age of 60. In women, uh, till the age of 70, the cholesterol risk increases. So they have to focus on reducing their sodium intake, both men and women. Okay. And also controlling the fat intake, especially saturated fat intake. It has to be controlled. Immunocompetence, that is the strength of your immunity, it decreases with age. The lower immune function that you have, that is the ability to fight infections and also to fight cancer, it reduces. So supplements like vitamin E, zinc, okay, is required so that your immunity doesn't fail. Then usually senior citizens will have a lot of dietary restrictions, okay, usually salt restriction, but too much of salt restriction will lead to a condition called hyponatremia. Okay. So electrolyte balance should be there. So these are the physiological changes during aging. Then the psychosocial changes during aging. Okay. The mental health. Depression is very common. Okay. And that also leads to unexplained weight loss in older people. 15% of senior citizens who are above the age of 65, they have a higher incidence of depression, especially uh, senior citizens if they are living in an uh, extended care facilities or senior citizens care facilities, okay, not taken care by their family. Okay, they have been admitted into these senior citizens care facilities. Okay, they have a higher risk of developing depression. Memory impairment, again caused by various type of dementia, Alzheimer's disease, Parkinson's disease, okay, various neurological diseases. Risk also increases dramatically. Half of the population over the age of 85 is affected with these memory impairment disorders. Weight loss, not having proper nutrition, okay, these could be a reason for memory related disorders as well. Alcohol abuse, it's usually unreported, especially 1/3 of the alcoholics age is 65 years or older. Okay, older men, they tend to be more alcoholic because usually they start drinking much later in life. Okay, usually after retirement they will start drinking because they consider that they are free of their burdens, they have done all their responsibilities, now they can enjoy life, so they resort to drinking. Okay, so excessive alcohol intake, that can also increase your morbidity and mortality risk. It will lead to physical and psychosocial problems, both alcohol abuse. And social isolation, it becomes more common because of declining income. Okay, they are not able to produce enough income for the family because of old age, health issues. If they have lost their spouse, they have lost a lot of friends, or they are not getting enough assistance from their family, that could lead to social isolation, and it will lead to depression and other mental health issues as well. So these are the psychosocial changes that happens in aging. Basic energy needs and nutritional needs. Calorie requirement will decrease with age because metabolism goes down. So calorie consumption should also go down. But it also depends on what is a person's activity level and health status. Calorie depends on that. But usually for the general population, calorie requirement declines because there is a decline in basal metabolic rate. Minerals like calcium, iron, okay, has to be maintained. The requirement of these minerals has to be maintained to prevent bone demineralization and to prevent anemia, different types of anemia. Supplements can be taken if food cannot be you cannot depend on your food to meet the requirements. Then protein requirements of elderly citizens are same like adults. Okay, 0.8 to 1 gram of protein per kg body weight is recommended even for them. But if they have any kidney disorders, some liver disorders in which they have been specifically told to reduce their protein intake, only then they have to reduce it. Otherwise, it is uh, normal, the normal intake of protein, 0.8 to 1 gram of protein per kg body weight. If there is a protein deficiency, risk for infections and other diseases will get in. Complex carbohydrates should be more in their diet because it has more fiber, which can help in emptying the stomach, avoid constipation. Complex carbohydrates are rich in vitamins and minerals. It also is, it will also help keeping your blood glucose levels under control. If you're lactose intolerant, drink plant-based milk or milk substitutes, have fermented dairy products. Saturated fats should be reduced. Okay. Total dietary fat intake will also be reduced, especially saturated fat should be reduced. Eat more vegetable seed oils, vegetable nut oils. Antioxidants like vitamin E, carotenoids, vitamin C, if not via food, but at least through supplements, it has to be given. Requirements of vitamin B complexes should be met. Vitamin A requirement will decrease over age. So these are the basic energy needs for elderly citizens. Other disorders associated with aging and dysphagia. Dysphagia means not able to swallow properly, difficulty in swallowing, dysphagia. It increases with age. So usually older citizens are given porridges or semi-liquid diet that is easy to swallow. In conditions like stroke, Alzheimer's, Parkinson's disease, multiple sclerosis, okay, people who have lost teeth, who don't have a good denture, okay, in such conditions, dysphagia will be there. So give them semi-liquid diet, semi-fluid diet, easy to swallow diet. Don't give them hard food, dry food. Then aging and fluid balance. Dehydration is the most common cause of fluid and electrolyte disturbance. So uh, also older citizens will not understand their thirst sensation. So they will not drink enough water. Okay. They don't feel thirsty because their thirst sensation is getting lost. So they don't drink enough water and they become dehydrated. And also certain medications, if they are suffering from BP, high blood pressure, some diuretics and laxatives will be prescribed. Okay, that can also lead to dehydration. Okay, it takes away a lot of fluid from your body. So adequate water intake should be taken. 1 ml water per for every kilocalories should be consumed. If the person has 1,800 kilocalories, 1.8 liter of water should be consumed at least, or 25 ml of water per kg body weight for most individuals. Like that, you can maintain your fluid balance. Aging and skin integrity. Skin breakdown is also a common problem, particularly in bedridden patients or people who are immunologically impaired. Pressure ulcers can also cause skin breakdown if they are bedridden. They have a risk of pressure ulcers, bed sores. So for pressure ulcers, it has to be taken care of. Okay, proper body massage, changing the position of their sleep. Okay, applying ointments to prevent any wound on the bony prominences of the body. Like that, you have to take care of the skin, especially the skin which is over any bony prominences in the body. Aging and malnutrition. Majority of the elderly people, they maintain adequate nutritional status. Uh, if they are institutionalized, like at elderly care institutions, if they're hospitalized because of chronic diseases, okay, they are at higher risk of malnutrition than the people who live with their family or who live independently. People who are hospitalized or in institution have a higher risk of developing malnutrition. And people who are survivors of cancer, they go into a state of cancer cachexia, okay, in which severe muscle wasting is seen. They are emaciated. That means that is they have lost a lot of their uh, muscle mass because of malnutrition, because of protein deficient, because of their protein deficient diet. Protein calorie malnutrition can also take place, or plain protein malnutrition can take place in cancer patients. So in such situations, some enteral tube feeding. So in such situations, some enteral tube feeding, nasogastric tube feeding, gastric tube feeding, that can be considered to give solutions for the nutritional problems. Coming to the assessment of nutrition in elderly, how to check if the elderly is suffering from some specific kind of malnutrition. A proper physical examination is done. Dietary history is taken. Okay. From that, the doctor can understand what kind of nutritional deficiencies the patient may be going through, or a comprehensive vitamin panel from the blood test can be evaluated. So that will give exact conditions, what kind of malnutritions or micronutrient deficiencies the person is going through can be assessed. Okay. Then weight evaluation. BMI between 21 to 27 is recommended. So if they are between, so they are about 21 and between 27, it means they are living a healthy lifestyle. Then dehydration evaluation, physical assessment is done. Fluid intake, food intake is done. Uh, their blood, urea, nitrogen levels will be assessed. Blood samples, urine samples will be collected to find any protein in urea, okay, albumin levels, serum sodium levels. Okay, these things will help you to understand the level of dehydration the person may be going through. If the person has hyponatremia, that is very less amount of sodium in their body, that is hyponatremia, that has to be addressed, which means the person is losing a lot of fluid. Along with fluid, they're losing a lot of sodium as well. Okay, so you may have to restrict them from taking diuretics or laxatics for a while. Okay, so that's about assessment of nutrition in elderly. If you have any queries, you can mention in the chat box.